Hello parents, I'm Dr. Jack Adrian of ChiroCenter, and I'm here today with one of our younger patients here at ChiroCenter. She's quite a bit taller than she was when I first met her a few years ago, but together in this short video we would like to share with you how to do an at-home posture evaluation, an actual demonstration of a structural screening in order to provide you the opportunity to take a quick first look to see whether your child, or for that matter, any member of your family, may be experiencing a postural or structural distortion of their skeletal structure that could be the cause of any mysterious pain they may be talking about or trying to bring to your attention. Now, unlevel posture is a very commonly overlooked cause of many types of pain in children and adults alike. And when someone presents you with a mysterious or a recurring type of pain in their musculoskeletal system, a postural distortion is very often the cause of that pain. Now, here at ChiroCenter, we don't call a posture problem poor posture, as in this case the word poor insinuates bad, and we don't want to place a label on someone that could lower their self-esteem, especially a child, by calling something about them bad. So here we call a postural problem unlevel posture, which is also a more accurate definition of what is really going on. Now, at the end of this video, I will also share with you where you can find a posture exam form to record any challenges you may find in your family's posture. But the best way to get started is to simply follow me as I guide you through this simple screening protocol, so you can see how it's done, and then when you have the form, you can record your findings. Now parents, before we begin, we will be exaggerating some of these movements for sake of explanation, so they come through clearly on this video. But it's important to understand we are not just looking for the blatantly obvious structural challenges, but also the hard to see deviations as well. Some of these deviations you'll be able to spot easily all by yourself with just me guiding you through them, but others may need a trained eye. They are each important because even minor structural distortions can cause significant pain and other health challenges. So let's begin from the front. With the body at ease and no conscious straightening. Again, this is very important. At ease and no conscious straightening. Does their head sit level on their shoulders? Or does it tilt to the left? Or to the right? In checking for abnormal neck rotation, does their nose sit directly in the midline of their chin? Or as you stand back, is it deviated to the left or to the right of their face? Or do you see a fuller view of one of their ears more than the other? Are their shoulders level? Or is the left shoulder lower than the right? Or perhaps the right shoulder lower than the left? Does one of their shoulders seem to lean forward of the other? Can you tell if both shoulders are high and erect? Or do they slump forward again, even slightly? Are their hands level at their sides? Or does the left hand hang lower against their leg than the right? Or perhaps the right hand hang lower than the left? Now take a look at their belt line. Is the belt level from left to right, or does it ride higher on one hip or the other? Are both of their feet pointing forward, or does one foot rotate out farther than the other? Now taking a look at them from the back, again with no conscious straightening, does one of their shoulder blades protrude out farther than the other? Or does one blade sit lower on the back than on the other side? Have them flex forward, and as they do so, does anything you see with their shoulder blades become more pronounced, such as does one stick out even further than before? Now, asking their permission or using your own discretion, raise the back of their shirt, which we won't do on this particular video. But does it appear they have a curvature in their spine? And parents, anything other than straight as an arrow is what we're looking for. Now, looking at them from either side, and parents, once again, I hate to remind you of this, but again, with no conscious straightening. In other words, have them just standing normally. Does the center of their ear canal line up directly over the top of their shoulder? Or does their head lean forward, even slightly of their shoulders? This is the beginning of one of the most devastating postural challenges of all, known as anterior head syndrome or forward head posture. Does there appear to be a developing hump at the base of their neck? Parents, especially so in older children such as teenagers or adults. Does their upper body seem to lean slightly forward? Do they have 3 well-developed curves in their back? One in the neck, another in their mid-back, and the other in their lower back? Or do these seem flattened or too accentuated? So this is how easy it is to do an at-home posture evaluation on your children and other family members. Again, some distortions may be blatantly obvious and others may be quite hard to see. Now in just a minute, I'm going to share with you where you can find your posture exam form, and also found on the bottom of that form is a posture scoring system to help you determine the state of your family member's posture. After you're finished, you may find your child or other family member has no postural challenges at all. And if so, I want to congratulate you for most likely being one of the healthiest people in our community. In all likelihood, the individual that you perform the examination upon is full of life and energy. On the other hand, if you did find postural deviations, their spine may already be heading for, or perhaps already in, some form of deep postural stress that is causing or will eventually cause significant wear and tear on the joint structures of their frame, leading to troubling challenges in the future. Small postural distortions must always become larger postural distortions as time goes by, until decay and breakdown of the joints leads to arthritis, damaged spinal disc, and a wide array of other health challenges. Indeed, level posture, or a lack thereof, is a huge key in determining an individual's overall health. I would like to thank our nice young little patient here for assisting us today, and I would like to thank you for your attentiveness. And I hope in the posture exams of your family you find nothing but good news. But if after you've completed your at-home posture examinations, if you found postural challenges or if you have additional questions, I invite you to call me here at ChiroCenter for a complimentary consultation, where together we can sit down and discuss any concerns you may be having. From ChiroCenter, I'm Dr. Jack Adrian. Thank you for watching. And now here is where you can find the posture screening forms for your family.